everybody. Dr. Sia here. I'm really, no, I'm not really. Just a second. Welcome to this new playlist that I have here. No, that's not what it's called. Dr. Sia here. It's a series on, what's the diagnosis? Oh my goodness, why do I keep forgetting? This is probably my third attempt just trying to say what I'm about to say now, which is, I'm Dr. Sia, and welcome to this new series that we call What's the Diagnosis? And this is an intro that I'm setting up here for you just to have a conversation with you about this series that's coming up. Because look, here in the Dr. Sia channel, one of the things that I'm trying to do is to, together with you in the community, further engagement, education, authenticity, learning, and so on and so forth. But to do that, sometimes, just sometimes, we have to talk about some really difficult topics. And whenever we talk about a diagnosis, we are talking about a really difficult topic. And the thing is, like, some of us might feel then that we do that, we have to be grim and we might have to be sad about it. We don't have to be grim and sad while we're learning. See, we learn and we use humor and we use energy and we use engagement while we're learning, but at the end of it, so that when it matters, that we can be really serious when people's lives are actually affected. So I just wanted to say that in case some of you are feeling like you're getting offended that I'm being a bit too jovial or anything about it. It's not. At the bottom of my heart, I have so much sympathy and care and empathy for all of the people who are suffering with any mental health problems. But as we're learning, we have to have a certain set of energy inside us. Otherwise, we're not going to remember. We're just going to feel down and we're going to disengage. So what this series is about, what's the diagnosis, is me providing you as a learner, as a fellow psychologist, as a social worker, as a student in any one of these, as a counseling student, for example, to learn more about how we diagnose, how we set hypotheses for diagnoses. And diagnosing is a very serious thing, so we don't want to get it wrong, and that's why I'm getting involved in this. I'm getting involved in this because so many times I've seen people just getting a diagnosis haphazardly, and I've seen the negative effects that it can have on a person's life. So part of trying to stop that is to make sure that there's really good educational resources available. And what you can do with this series, with these videos that will be available in this series, and I will post 3 or 4 just right after this intro, so keep an eye as well, because I'll keep posting videos about these different diagnoses, is that you'll get an opportunity to see me conduct an interview with another person, an actor, and in that moment, what's going to happen, and this is the part that's really crucial, I think, that we often don't get with other diagnosis videos, is that there'll be a pause. Before I provide my hypothesis about what I think the diagnosis will be, there'll be a bit of a pause, and you'll get a chance to think yourself. You get a chance to think about the things that you've seen. You get a chance to think about the questions that I've asked and the statements that the patient in that moment has made before you sort of put your own hypothesis out there. And then you get to hear what my professional opinion would be at that time. Now, another disclaimer. These videos are 10 minutes. No way would I ever diagnose anybody after 10 minutes. It's just not going to happen. But developing a hypothesis about what might be going on for the person is something that we do from the first minute. We sit down and we're immediately hypothesizing, and we continue hypothesizing throughout the rest of treatment. We're never fixed in any way. So what I will deliver is my hypothesis about what's going on. After that, I'll do more clinical testing. I'll use some really standardized, valid measures as well to really get the truth out there. But this will be an opportunity for you to engage with it, to engage with me and engage with the patient and learn more about how to diagnose and what diagnoses are all about. I really hope that you find this useful, that you find this engaging, and that you find this as a useful learning tool for yourself as well. Please remember to subscribe, to like, to drop something down in the comment box as well. I'm really curious to hear what you have to say about this series that's coming out. I'm really excited about it. I think it's going to be really good, and I really look forward to it. I'll see you around soon.